impact the industry. A key leader in that effort has been the Northern Colorado Health Sector Partnership. And today we have Jonas McKinley, past chair of the partnership, here to provide an update on the work of the partnership and how you can get involved. Please welcome Jonas McKinley.
Hello, everyone. All right, give me 1 second. I'm going to get my presentation up and we'll get this going. All right, so great introduction from Ann. Again, the healthcare sector partnership here in Northern Colorado represents both Larimer and Weld counties. So this has been kind of an ideal venue for us to present and share what we're up to and what we have going on. So today I'm going to give you kind of some updates and some overviews. Certainly this year has been a challenge for organizations like ours that get together and work on efforts together. It's been a challenge in two big ways. We have a membership of healthcare providers and professionals that have a lot going on and are reacting to this pandemic and changing the way they do business. So that's been an impact. And then the other thing has been we haven't been able to come together in person, and in-person meetings have been curtailed. So those have been some challenges, but we've been able to keep going and do some really cool things. So our mission here at the Northern Colorado Health Sector Partnership is to bring together key stakeholders to promote and improve health within our communities. So we collaborate across disciplines, organizations, and communities to seize opportunities, solve problems, and celebrate successes in the region. So we started in 2013. We had about 30 organizations, and if you were one of the people at those early meetings, we had probably 15 to 20 kind of key people after our kickoff meeting, which had really good attendance. But we've seen consistent growth over the last 7 years. So now in our 7th year, we have 82 organizations participating, representing basically every healthcare industry, company, business, you name it, in our region participates. And then we have 496 members. So it's not just healthcare industry companies that participate. We also have support members. We have our public sector partners in our education system, in our municipalities that not only provide funding, but provide expertise and provide lots of support to our industry in the efforts that the industry decides they want to work on. So again, the important thing in a sector partnership model is that the industry drives these efforts. We, as the industry, decide what we want to work on, what's important, what would help drive business economic growth. So what we're working on, we have kind of some key areas that we're collaborating on. So we're working on education of the public on healthcare, doing outreach and bringing people information that would be helpful and benefit their lives with regard to healthcare. We coordinate a behavioral health effort. So I'm going to talk in a moment about things we're working on there, but a very important issue and one that I've been excited that our partnership has decided they want to work on and tackle. Another thing is workforce. So when you look at these health sector partnerships across the state, everyone is working on workforce. So that's going to be a challenge no matter what part of the country you're in, no matter what part of Colorado you're in. There's a decent chance you're having a challenge hiring the right people, finding enough people when you need them. And our workforce team does a lot of great work around that. And then PASSAR is kind of the final thing that we're working on that affects our nursing homes, affects our hospitals, and is something that we've put a lot of effort into trying to streamline and improve so that that process works better for patients and for our facilities.
So, Jonas, we actually didn't get to see your slides. You shared some fantastic information. I just want to make sure that if there was anything you wanted to make sure our attendees could see, we give you that second to share that.
Is that sharing now?
It is, yes.
Okay. Yeah, sorry about that, guys. All right, let's go. I don't think we need to revisit the last couple. So here are those kind of 4 key areas. So just to revisit those real quick. So we have educating the public, behavioral health, workforce, and then PASSAR. So these are the ones that you want to see because there's a lot of text, and if you want to ignore what I'm saying, you can focus on these. So behavioral health, we have a couple things that we're working on right now. One is kind of an exploratory event. So we've realized, particularly with the Larimer County Behavioral Health Center opening up soon, that we're going to have a real workforce need in behavioral health in Northern Colorado. So we're trying to get more people interested in this area, get them into our education system here in Northern Colorado, which does a great job of educating people for careers in behavioral health. So that exploratory event will be in February of 2021. So we're planning that out. Again, it'll be virtual, so people can attend from anywhere, which we think will actually really benefit our college students and even younger, maybe high school students that are interested in careers in behavioral health, where it might be difficult for them to get to a Embassy Suites or get to one of our hospitals or a place where we would host an event like this. Now we can have that event virtually, and we're hoping to get really good attendance at this. So they'll learn about all kinds of things they can do to get into behavioral health, what that looks like, and the opportunities that are available. The other thing that our behavioral health team is working on is a resource library. So this is another pivot that's happened because of COVID. We had been working for a few years now and putting kind of a speakers bureau together is what we were calling it, where we would have experts available that could go out and speak to students, that could speak to businesses and talk about behavioral health. So an effort that we did 3 or 4 years ago was we rolled out mental health first aid in Northern Colorado and brought that to a whole host of new businesses that hadn't had that kind of education before. And the goal was to kind of expand on that and have different speakers, but that can be challenging. So when you're a behavioral health professional, you may not have the opportunity to leave your job during the day and go present somewhere. What we found is that people are very open to having that knowledge recorded, though, doing it one time, maybe from the comfort of their home or their home office. And if we can record that, now we can build a virtual library that then we can push out to our members. So this is something, again, that out of COVID could actually be a really positive thing and a change that committee has had to make in response. Our workforce team. So again, our workforce team is absolutely supporting the behavioral health team. I've seen those two committees working together this year in talking about this Larimer County Behavioral Health Center and how they can help get the right workers in there and make sure that we have the professionals that we need to staff that facility. So that's been a great success. This committee has been extremely active throughout COVID, which has been very impressive, that there hasn't been a drop off in attendance or in people unavailable. We've seen all of our committees for the most part have been very active, which is really encouraging. So November 18th, there's going to be a virtual chat that they're organizing on in-demand careers. And then they're going to be talking to high school students, college students, and job seekers about what those in-demand careers are and where they might want to direct their education efforts or the types of jobs they might want to apply for. It's a very successful program that we launched a couple of years ago. It's called Getting Into the Guts. I've mentioned that at this event before. I like to mention it often because I love the name. And you can't really get into the guts in a COVID pandemic environment where, certainly taking a busload of students, getting students in a bus is probably a problem. And then taking them to a hospital or a medical facility is not ideal. So what we've done with that event is we've moved that virtual. So we're working to move that all online and have that event available. And again, this is one of those things, this has been a costly program because we do have to get people to these facilities. We've been sponsoring buses and doing all that. And in a virtual environment, we can have multiple schools participate. We can get people into areas of the hospital that maybe we couldn't previously because it wouldn't have been conducive to walking students through. So we're really excited at the opportunity here to kind of change the way we've done this event and still get people excited about healthcare, get them to realize the multifaceted opportunities available within healthcare. That's not just all nurses and doctors. So that's exciting. They also have a data team that's working on some surveys and research gathering, and then they're hoping to improve their outreach and improve some of their communication. So again, taking some more things online, that maybe have been done in person and looking for ways to expand their reach. One thing I wanted to do while I have some time, again, I think our sponsors and the people that support the health sector partnership are the same people sponsoring and supporting this event. But I just want to point out our champion donors. We had Columbine, City of Fort Collins, City of Greeley, Colorado Workforce Development Council, Banner Health, Kaiser Permanente, the Chamber of Commerce, and UC Health. Were all major donors the past year. And the donor amounts that we've received from them really allows us to keep this group going. So it's all volunteers, except for an administrative staff person that we've been able to bring on. It really helps keep things organized, put this PowerPoint together for me, and makes things flow. So it's very important. Also want to point out, we do have other donors as well. Front Range Community College, Collaborative Economics, and Associates in Family Medicine have all stepped up to support our efforts. So if that's something, if you're interested in being a supporter, or if you have supported in the past, thank you, and we look forward to your support going forward. I wanted to let everybody know, if you like what you've heard, a lot of people on here are members already and are coming to our meetings and participating and working on these committees. But if you're not, we'd love to have you. Our next meeting is November 18th from 7:30 to 9. Again, everything is online. It's on Zoom. We have great breakout sessions. We've had great presenters and great programs for you. This month, we're going to be doing a tour of the new Front Range Community College facility. They have a new healthcare campus that's really exciting and going to be really beneficial to healthcare in Northern Colorado and to all of our members. So really excited to get people into that and let them see that. You can register on Eventbrite by looking up that event, or you can simply email us, get on our email list. So it's nocohealthsector@gmail.com. You can also find that email at our website, nocohealthsector.org. And you can get a lot of information, things that I've presented today, and some other stuff about past accomplishments and things that we're doing. So thank you for the time. Really appreciate it, Anne. Really appreciate you guys all for participating and joining online. Again, I'm really excited to see this event continue, even without being able to do it in person. So thank you.
Thank you so much, Jonas. The work of the Health Sector Partnership is key to the success of Northern Colorado and healthcare in Northern Colorado. We really do appreciate all that the partnership has done. Again, as Jonas said, if you aren't connected to the partnership, please do check them out at nocohealthsector.org. We now want to transition